A few hours ago, Mayor de Blasio, the mayor of New York, said that New Yorkers leaving their homes should wear masks. They should also wear masks when they're with other people. Are you considering that kind of recommendation on a federal level? And if you are, how would you prevent a rush on N95 masks?
Well, I think they're going to be coming out with regulations on that, and if people want to abide by them, frankly, I don't think they'll be mandatory because some people don't want to do that. But if people wanted, as an example on the masks, if people wanted to wear them, they can. If people wanted to use scarves, which they have, many people have them, they can. In many cases, the scarf is better. It's thicker. I mean, you can, depending on the material, it's thicker. But they can do that if they want. Now, a recommendation's coming out. We'll see what that recommendation is. But I will say this. They can pretty much decide for themselves right now.
Aaron, just a few fact checks to do. I think one is very important. The president continues to give people medical advice that is dubious at best. In talking today about masks, he said that in many cases, using a scarf can be better than using an actual FDA-approved mask because he said it's thicker. Now, there's still more studying to be done of the effectiveness of various kinds of devices against this virus, but that advice is not what the CDC says. The CDC says that things like scarves, bandanas are last resort options for healthcare workers. They have not been proven effective. So if you're considering wearing a scarf over a mask because the president told you to, please don't.
Well, I mean, right, and I'm going to ask Sanjay about that in just a moment as well. I mean, just as to where that sort of a claim would come from. John King, in the meantime, the president did just say that they're looking at a lot of different bans in response to a question about Japan barring people from the United States, Americans coming in, whether he would reply in kind. His response was, well, we've done more bans than anybody. And of course, he actually went all the way back to the original Muslim ban when he came into office. But does that presage even more bans coming in terms of transit and travel?
The issue in a ban is if you see someplace around the world that has a growing problem, you want to limit input from their citizens, incoming from their citizens. But when the president says we're looking at that, that has become early in the administration. He would often say, have something in 2 weeks, we'll have something in 2 weeks, we'll have something in 2 weeks, which was his way of pushing it aside. He says at these briefings all the time, we will look at it. But back to the point you made, the president did, after being urged by Senator Tom Cotton and others in Congress who saw this problem way before the administration did, he did, and he deserves credit for the travel ban on China earlier. And he was criticized for it. Chuck Schumer called him a racist and then deleted the tweet for that. He deserved credit for that. The issue, though, when you go through this, and then he did the European ban later, and again, a lot of the public health experts would tell you, look at what was happening in Italy, Spain, and elsewhere. There were some holes in it, I get it, but that it was a wise move. It was a piece of a move. The issue, Aaron, is everything else. The issue is not his reflex is you're telling me to ban travel from a foreign nation. I will do that. The question is when he banned the travel from a foreign nation, at that moment, if he had said that's a sign we have a problem coming, let's ramp up a testing paradigm. Let's how many ventilators do we have? Is it enough? Are the ones we have they been maintained? Let's put all the states on alert. Let's pick up whether it's Jared Kushner in charge, pick who's in charge, but put somebody in charge and start this back in January or early February. We'd be having a different conversation tonight. They didn't. He minimized this for months, even though he did implement that China ban.
All right. Thank you all very much. And I want to just bring in Sanjay now, Dr. Sanjay Gupta. And Sanjay, I want to give you a chance to respond. You know, Daniel Dale just brought up the point of what President Trump said about masks, right? He was asked about whether they were going to do a formal, telling Americans to wear masks. And Trump's response was, you could use a scarf. And he said, in many cases, a scarf is better. It's thicker. That's the exact quote. Is that true?
Well, I don't know that it's any better because it's thicker, but I think that there's a fundamental point that I think is different here versus masks, for example, in hospitals or healthcare settings. I think what has changed here, Aaron, and the reason that you hear the LA mayor now recommending masks, I think Mayor de Blasio also recommending masks for people going out in public. It's because of this idea now that people who are asymptomatic, not knowing that they, not having any symptoms, not knowing if they have the virus, could still be spreading. So these are not hospital-grade masks that we're talking about, the surgical mask or the N95 mask, but rather some sort of cloth mask to wear when you go out in public because you're trying to protect other people from you. as opposed to in hospitals where healthcare workers, where they're trying to protect themselves from the patient who may be putting a lot of virus into the air. So it's a different thing. If you wear a mask and you have virus in your nose or throat, you may be sort of reducing at least the amount of virus you're putting into the environment. I think that's what's sort of driving this thinking. It's a little bit opposite, I think, than the way people have thought about masks. Again, it's not to protect yourself. It's to protect others from you,
right?
And that's I think that's what the President Trump was talking about.
Well, it's really well said that you say that, because I do think because America is not culturally a mask society.
Yes.
Anytime you travel in Asia, those are mask societies, right? They see it differently.
That's
Here,
right.
there is sort of a maybe people feel, what are you trying to say about me, when it's real, when they see someone else wearing it. To your point, that
right.
you would be wearing it to protect others from yourself is something that perhaps if people think about it more, they might feel differently. But part of this, I think, Sanjay, we've known it can spread asymptomatically, but what seems to be perhaps new is that experts are now telling the White House that it can be spread by just talking or even by breathing,
right.
which is not what we had heard. So is that really a new thing here? And why would we just be discovering that now?
Yeah, no, well, this as you know, Aaron, came from a letter that was given to the White House based on some research. But, I've spoken to many of my contacts and even spoke to Dr. Fauci about this a little bit. And, here's, I think, another way to think about it is that we have essentially been saying this all along. I mean, if you don't have symptoms and you're still spreading it, how are you spreading it? Just through your breath, and you're not coughing or sneezing the viral particles out. You're just basically, the viral particles are in the back of your throat, in your nose, and just through daily activities of life, talking, breathing, you're releasing a little bit of virus into the air. I will say this: it is true. I mean, the science, I think, is pretty clear now that can happen. But how much is that really driving the spread of this? It's probably a lot less than someone who's clearly symptomatic. Those are the people
right.
who are probably really driving the majority of the spread. It's something to be aware of, and obviously we're doing everything we can, or people want to do everything we can to mitigate, slow down the spread of this virus. So this is another step and another thing to be aware of.
Right, certainly, and one that will cause, some concern among people,
Yes.
right? I mean, I guess in a sense, when you think about it, when we hear, and we're going to talk to someone, later in the show, the number of people who are getting this from parties or, casual, the group settings, choirs, it's kind of clear that what you're saying is true, but hearing it nonetheless is quite sobering. And it comes, Sanjay, as one of the death toll models that the White House has been giving, and they're talking about at these briefings, was just revised upwards. They had originally projected 82,000 deaths by August. They're now projecting 93,500. Again, these are projections. They're not any better than the inputs that they have, right? And that is a crucial caveat now, because everything is an assumption. But what has changed? Why would that change so quickly?
Well, it's really interesting, and we spent a lot of time looking at these models and spoke to Chris Murray, who developed these models at the University of Washington. What's interesting, Aaron, is that you're putting in new inputs every day. And one of the things, as I think you and I talked about last night, that is fundamental to these models is that by the end of this week, by Friday, tomorrow, you have to have every state with stay-at-home orders. That was these numbers would only be around what they are, 80 to 90,000, if you actually had stay-at-home orders in every state. Every day that goes by where you don't have those, and there's still several states that don't have them, some have declared it but haven't implemented it yet, it drives up the numbers. So that was one thing. But in addition, when you really dug into those numbers, as we did today, you found that the critical shortage of hospital beds and ICU beds, what they predict those shortfalls will be, also went up, Aaron. So, in part, if you're saying, look, we don't have enough ICU beds for the patients who are going to need them, that means that there's patients who aren't, going to get the care that could save their lives. And sadly, that drives up these mortality numbers as well. So the two things are going hand in hand. They may bounce around a bit, as we hear, as some of these hospitals are developing surge capacity, and we're seeing field hospitals, near you in New York City. But right now, they're not going in the right direction.